St. Mary Development Corporation would like to thank some of their great sponsors, generous supporters of this year's Business of Aging event. And all of these companies have been with us over the years. And because of them, St. Mary can bring this virtual event to you absolutely free. A special thank you goes out to our gold sponsors, Ohio Capital Corporation for Housing, OCCH, also Related Affordable, and Rasili Construction Company. And we are also very grateful for our silver sponsors today, Bowen National Resource Company, LCNB National Bank, River Hills Bank, as well as Pivotal, formerly known as MVAH Partners. So now let's introduce the president of St. Mary Development Corporation, Tim B. Tim?
Each year, St. Mary holds the Business of Aging event to discuss topics around older people, housing, healthcare, and technology. This year, we're talking about how organizations that serve older people are navigating staffing shortages. Many people know St. Mary as a developer of affordable apartment communities for older people. But going back to our beginning, our real focus has been on the overall quality of life of seniors, using safe, decent housing as the foundation. While there's no single agreed upon definition of quality of life for seniors, most definitions revolve around social determinants of health. Social determinants of health are the conditions in the environments where people are born, live, work, play, worship, and age. They affect a wide range of health, functioning, and quality of life outcomes and risks. This includes factors such as your housing, transportation, your access to health care, your access to food, crime, and more. So after we build an apartment community for our new residents and they move in, our service coordinators work with residents to connect them to programs and services they need to remain independent. Things like doctors, food programs, transportation, home health aides, and more. We work with more than 100 health and human service partners to bring these services to our residents. And if our residents need a higher level of care, like a skilled nursing facility, our service coordinators help with that transition too. Sometimes these are huge issues, like getting a home health aide for a resident who can't bathe themselves any longer. We know if that resident can't get a home health aide, they will suffer. Sometimes they are smaller issues, but with a big impact, like one of our residents who was given a sweatshirt from his best friend before his best friend passed away. The sweatshirt had a lot of sentimental value, but it was a pullover, and he wasn't able to get the sweatshirt over his head by himself. Our service coordinator helped that resident find a seamstress to put a zipper on the front of the sweatshirt so he could wear it. And the seamstress donated her time because the resident was a veteran. That's the dedication, love, and compassion we bring to our residents every day. But it's getting more and more difficult to connect our residents to services. They may qualify to have a home health aide come to their apartment, but that doesn't guarantee one will be available. Home health companies are having difficulty finding enough workers, which makes the work of our service coordinators that much more difficult. We're seeing many of our residents suffer because of staff shortages, and there are no easy answers. Talent shortages across the nation are plaguing organizations of all shapes, sizes, and missions. And as America's aging population continues to increase, many of us are concerned about how we will continue to serve those in need while navigating a lack of workers. Staffing shortages and their impact on older people is a critical issue. And as St. Mary does whenever we see a difficult situation, we talk with our partners to clarify the problem and think about ways to solve it. Today, we have 3 amazing partners with us to share their thoughts on staffing shortages. Aisha Williams from the National Council on Aging is with us, and she's going to share a national view of the issue. Susan Wallace from LeadingAge, Ohio will share what she sees going on across the state of Ohio. And Nicole Connor from the Dayton, Ohio Area Agents on Aging will share a local perspective. We are so grateful for their willingness to share their expertise with us today. We're not going to solve every staffing issue today, but our hope is that conversations like today's will connect organizations who can come together to find and implement the most effective solutions possible. There are many, many older people counting on us, and I'm thrilled that you're here today to be part of the solutions that will transform our work and transform the lives of older people in Dayton, across the state and across the country. And if you'd like to talk with St. Mary Development about how we might work together, please get in touch with us. Just go to our website and click on the Connect button at the bottom of the website page, and we'll reach out to you. And thanks again for being with us today.
Good morning, everybody. I want to thank St. Mary's Development Corporation again for inviting me this morning to be able to share our insights at a local level regarding the direct care workforce shortage and this critical topic. As Dan mentioned, my presentation today is going to involve sharing the assessment that we did in partnership with the Dayton Foundation and the Del Mar Encore Fellowship grant that we were awarded. Next slide. For a quick overview, I'll talk about just the background and how we came into that partnership, and as well as some of the demographics that we evaluated. We'll also talk about the problem as we uncovered it, both from a agency provider perspective, but also from a service recipient perspective. I'll certainly address the impact of the COVID-19 pandemic and what we're seeing as an impact on services related to direct care workforce shortages, and some of the recommendations and strategies that we are supporting putting forward to navigate and address these issues. Next slide. So as Dan mentioned, in 2019, we were selected by the Dayton Foundation to host a Del Mar Encore Fellowship. And it was our opinion that we really thought in order to be able to address what we saw as shortages in personal care service at the time, we really needed to kind of take a step back and determine what our region was experiencing, what the scope of the problem was, and the breadth of the issue. And so we had approached the Dayton Foundation and were fortunate enough to be selected as a host organization and embark on this research with the help of Dr. Kathy Stevens. So we set out to survey the broader landscape, as well as review the current research and the current analysis that were surrounding the issue at the time. And then try to create a set of recommendations that we could use to navigate to better serve the older adults that we were currently serving with the shortages that we were facing at the time. One thing that we thought was unique at the time was to really garner some input from our primary stakeholders, which included not only our own internal leadership and staff, but our partner area agencies on aging across the state, as well as the contracted home care, Ohio Department of Aging certified contracted providers that we work with, not only though they're owners, but the schedulers and the actual personal care aides themselves. We also did speak with some private home care agencies. And then, of course, we actually spoke with and surveyed the older adults themselves who were receiving these services. I'd also like to quickly point out that our area agency on aging does serve a 9-county region. However, our assessment, we chose to focus on our 3 counties that serve the most consumers in our care managed program, which include Montgomery, Clark, and Greene counties. And combined, we're generally serving about 6,000 older adults on any given day. Next slide, please. So the demographics of the older population is not a new topic to anyone, probably on this call and on this group. But although we know the number of older adults that there are, and generally the number of older adults who are being served by personal care aides, what we couldn't figure out is how many personal care aides were actually providing services in order to extrapolate how many are needed. And so we thought probably the best methodology to go forward is to compare the growth of the 65 plus population and the expected self-care needs to potentially the amount of aides that might be needed to serve those individuals. So you can see here on the graph on the left, our region, of course, is closely aligned in how we have forecasted the 65 plus population to grow in comparison to the state of Ohio. So we will be growing at essentially the same rate as you'll see elsewhere in the state. And the graph on the right starts to extrapolate those older adults who are growing who might have self-care needs and need a personal care aide in the future and thereby a personal need that self-care assistance. So we estimated in this assessment that with a 19% increase in the population 65 plus that is growing, that we could expect to see 34% of those older adults with self-care needs. And we tried to use the same methodology in an ACL report, 2017 profile of older Americans, to then extrapolate how many aides would be needed. And we determined that we would need at least 500 more aides serving those older adults by the year 2030. And quite frankly, almost upwards of 2,000 would need to be hired in order to continue to support the perpetual retention challenges that our providers were facing. So we quickly learned, that unless some fundamental changes had occurred or do occur, we would obviously probably be falling short of that target. Next slide. Of course, another thing at the time when we began our assessment was, of course, to review the current economics of the state of personal care aid service in our region. And so currently in our region, for personal care aid service, it is reimbursed at an hourly rate of $19.68. An individual who is providing the same type of personal care service, either private pay or maybe through insurance pay, might receive a higher rate at upwards of $23 an hour. And the average wage of a personal care aide, according to the Bureau of Labor Statistics in the state of Ohio, is $11.31. In our research and our interviews with our local provider agencies, they reported being able to pay their aides between $10 to $12 an hour. But it's important to remember that the higher rates that are being reimbursed to the agencies, of course, are not passed through directly to the personal care aide themselves. There's obviously operational costs that the provider agencies incur in order to continue to manage their business, such as not only the operational costs, but professional liability insurance, unemployment, mileage, benefits when they're offered, all combined make a very low margin of business for our area service providers and create a plethora of opportunities for their workforce to go somewhere else, such as Amazon for $15 an hour, and potentially with more benefits. Next slide. So the problem, as we saw it, we interviewed, as I mentioned, internal staff as well as over 30 providers, the majority of which were our Ohio Department of Aging certified providers, but we did interview some private pay providers. And this slide depicts, just some of the themes that came through as far as those agencies' perspective. Some of the highlights that provider agencies reported to us were that their retention is critical, that they have a hard time finding experienced candidates, and it's a challenge, and training requirements can oftentimes be a barrier to finding those experienced candidates. Of course, as we know, there's a slim margin for business, and the quality of service that's provided is definitely based on the quality of the aide that's hired. So in summary, what we found very quickly is that the number and the quality of aides are really what's determining the number of the consumers that we could serve and the level of service that could be offered. Next slide. When we spoke to the personal care aides themselves, we interviewed 24 personal care aides, the majority of whom were women, the majority of whom were Caucasian. Most of the aides had over 3 years of experience and most worked part-time. We saw a clear distinction in the age range of these aides where about half were ages 21 to 36 and the other half were ages 55 to 74. Those on the younger side of the spectrum were often living 25% below the federal poverty level and were receiving supportive benefits. Those who were at the older end of the spectrum often had a supplemental income to support themselves. When we asked this group of aides what was the thing they most liked to change about their job, their responses included pay, benefits, especially health insurance, paid time off, hazard pay, mentoring and networking opportunities, and more training on difficult situations such as death and dying, dealing with challenging family members, and training on dementia and stroke-related illnesses. Next slide. We also took a look, of course, and spoke with the individuals who are actually receiving personal care service and interviewed more than 50 older adults who attended 5 different focus groups at St. Mary's Development Corporation residential communities. Most of the older adults that we interviewed did report that they saw their aides and rated them as high as a 7 to a 10 in how critical that aide was in their health and well-being, and generally rated their aides' performance as very high. The list on the right includes just some of the characteristics that we heard from the older adults that we interviewed as far as what was important to them. Things, of course, like being courteous and trustworthy, having basic cooking skills, cleaning skills, and then, of course, being able to communicate and have some discussion about tasks that are needed to be taken care of. Next slide. So in review, we found that the older population is growing, but without any concrete data on the current direct care workforce shortage, there's really nothing to determine whether or not we are meeting it or whether or not we're going to be able to meet it in the future to meet the growing needs of the older population. We know that our agency providers want to provide quality care, but are struggling to do so now because of low reimbursement rates and the inability to staff the referrals that we're giving them. We know that the number and the quality of aides are determining who we can serve. We know that aides receive low wages, and generally in our region, they don't receive benefits such as even mileage reimbursement, training, healthcare, or paid leave. We know that aides who generally are working do find value in the position in their job. And we do also know that the older adults that we speak to do oftentimes compromise quality service in an effort to not lose service at all. Next slide. So pre-pandemic, we found generally that we were in a moderate to severe direct care workforce crisis or shortage. And COVID-19 essentially catapulted us into crisis mode. Pre-pandemic, generally, the driving force for personal care aides to want to leave that workforce was simply wage. In that personal care aide job at the time, their wage was $3 lower than a same entry-level position in our region. But with the onset of COVID, now we had additional issues that were causing aides to want to leave work, such as potentially their own sickness or a family member's illness as a result of COVID, childcare issues, remote schooling, and quite frankly, some aides found that they were able to make more money with COVID relief dollars than what they had traditionally made in their job. Next slide. And so the impact on services also that we're seeing as a result of these shortages is in complete crisis mode. You can see here on this slide, in our region alone, in our 3 counties, we have over 600 individuals who are not able to receive services. Now, that number does not include individuals who are receiving less services than what they've been assessed to receive. Statewide, that number is closer to 4,000. Next slide. So in summary, some of the recommendations and strategies that we put forward short term, certainly advocating for increased reimbursement rates and worker wages to a livable wage, putting forth a recommendation for this year's budget to a 50% increase, at least up to $20 an hour, pay for incentives and training. We've done that as a local organization through a PCA training. There's a variety of positions that can be developed that may help support linking consumers with services. And we think it's critical to engage family members as providers and expand consumer-directed services, which we have also implemented in 2022. Next slide. Long-term, some of the same apply as far as increasing reimbursements rates and worker wages, but also, creating task force. One has already been created in the state of Ohio to look at these issues, considering a statewide media campaign so we can really bolster the value of this position and the need for this type of care across the state. Next slide. And so if you'd like to see the full report, our full assessment and the research that we had conducted since 2019, please feel free to visit our website. Thank you.
As I am also a native of the Miami Valley. I grew up and my family has been living in the Miami Valley for over the last 200 years. So it's a pleasure to be here with you all. And thank you for the service that all of you provide to older adults in your community. So when I talk about workforce challenges, I often liken it to eating an elephant. And you may have heard the proverb, how do you eat an elephant? Well, you do it one bite at a time. Oftentimes, the workforce challenges that we're facing can feel like monumental struggles. And it feels like any one change is not going to get us there. And in fact, that's the truth. No one thing, there is not a magic bullet or golden solution that will get us there. We have to approach it from multiple angles. So before I jump into what we're doing here at the state level around workforce issues, I want to talk a little bit about the underlying forces, because I think it's really important to understand the reality. And Nicole did talk a lot about the growing population of seniors in our community. But I think what's really important to notice is it's not that we just have more seniors, but in fact, the proportion of seniors to younger people is changing over time. So in the last 100 years, we've moved from a population curve that looks more like a pyramid to one that looks a little bit more like a square or like a rectangle. And what that means is that we all are going to have the opportunity, most likely, to live a lot longer than our grandparents. I know in 1994, when my grandmother passed away at the age of 91, she was one of the only people I knew that had lived into their 90s, and most of my friends' grandparents did not live that long. That was a very long life at that point in time. And now we can expect that if you are lucky enough to live into your senior years, that most likely you're going to live into your 80s, 90s, and even beyond. It used to be that our centenarians that were so rare that we would get special commendations for them at the State House upon turning 100 years old. But in fact, there are so many centenarians now in our communities that that's not something that we even find remarkable necessarily, although certainly an exciting development regardless. So Nicole shared that we have this population curve, and oftentimes we talk about the baby boomers as if they're that we're going to have a boom and then maybe we'll see it recede. And you do see this population curve when you look at the 65 and older. But what I want to draw your attention to is the bottom blue line there, which is our over 85 population. So those folks are going to continue to grow in number in our communities. And that's because we're living healthier, we're living longer, we're addressing underlying disease, we are doing better in terms of wellness. And so we're seeing folks live longer into their latter years. And this is a great thing, but it means that we have a system that was built with certain assumptions in place, and we don't have that system anymore. So what that means is when you look at the relative population, we have a lot more older adults, particularly those that are the older, those 85 and older that may need care. And we have a lot fewer caregivers around to provide care for them. So new population means new systems. And as Nicole noted, certainly we saw the effects of the pandemic. These were all the data that I shared before, were what was happening in our community before the pandemic. And then we saw a catastrophic impact, not only on the older adults who lost their lives and who were, sickened by COVID-19, but also in the number of individuals that were willing to go into the field of healthcare. So what we see is that healthcare, individuals entering healthcare has slowed. And what we see is that's most pronounced in those fields that serve older adults. You see on the right-hand side of this graph, you'll see nursing facilities that have lost in real numbers 15% of their workforce between February of 2020 and March of 22. And assisted living is a lesser loss. And you can compare that to physicians' outpatient care that actually saw growth. This is not surprising because we were doing more and more services in outpatient settings in home health in order for individuals to avoid facilities where the spread of COVID was more likely. And then you put that against, the folks that exited the workforce early. And what we see is that the nurse staffing costs are increasing. So this is just really the change from 2018 to 2020. So this is really on the front end of the pandemic, but we saw growth in the wages that over that span of time that was really sped up. And I would say that once we see the numbers come back for 2021 and 2022, we're going to see this have a cumulative effect. We have a couple of members in the Miami Valley that have shared with me that over the span of the pandemic, their wages have increased by 40%. That is absolutely staggering. I've talked with other folks that have seen their increases. I have one member that just announced a $4 an hour increase for their STNAs, going from 15 to 19, because that's what they felt they needed to do to attract staff. And then LeadingAge Ohio, we are doing our own tracking in terms of the percentage of open positions as a percentage of total positions. And we're seeing similar trends where during the pandemic, it has gone from 20% of positions and is climbing up towards 30% of positions. I will say that we anticipate this going back down, not because we're going to be filling those roles, but because we are going to be seeing folks eliminate those positions permanently and scale back their operations. And what that means is that fewer older adults are going to be served in communities, and that's really a deep concern of ours. So what are the challenges in our sector? Well, certainly we know that we're not just competing, particularly for those frontline workers, we're not just competing with other healthcare entities, but with organizations that are able to offer massive sign-on bonuses and really high hourly rates. One thing that's important to note is that other sectors can raise their prices, but our sector is almost wholly dependent on Medicaid and Medicare programs. And so we are beholden to our legislators to increase wages, that increase the reimbursement, which just allows us to pass on increased wages. But there are other challenges. Ageism is real, and the perception of our sector has certainly taken a hit during the pandemic. I think when we think about our sector, we want folks to go above and beyond. We want them to be in relationship with the older adults they serve. And so that's more of perhaps an emotional toll, more that we're asking of them. There's not a lot of flexibility when you're beholden to Medicaid and Medicare to set your reimbursement. There's only so many levers that you have. And in some sectors of aging services, like nursing facilities, they're also very highly regulated. So there's not a lot of cost containment that can happen, or there's parameters around which that cost containment can happen. I will say historically, we've been perhaps slow to adapt to new hiring and workforce demands, although this is changing rapidly as we are seeing, this is a survive or not kind of predicament that we're in. So I'm seeing a lot more innovation from providers than we have beforehand. And then finally, we're fragmented and without scale. In Ohio, we have over 900 nursing facilities, over 700 assisted living, and I believe over 900 home health agencies that serve older adults. That's compared to less than 50 health systems, for example, across the state of Ohio. And so what that means is there's less ability for each one of those organizations to absorb some of the the overhead and the administration, and it makes it harder to implement big changes to how we design our jobs. So when I'm thinking about eating that elephant, I think about what are those bites. And so, oftentimes I will talk about wellness as a workforce strategy. And it's really the fundamental thing that we need to do. We need to decrease demand, which means we need to get our older adults healthier. When you're starting to hit the age of 40, 50, 60, what are you doing to deliberately attend to your health? What are we doing to make sure that those folks that are, maybe ahead of any kind of chronic disease can forestall illness, forestall disease by, taking some time and devoting it to wellness and health. So all the more important for positions like service coordinators that help check on nutrition, make sure folks are socially engaged. All these things matter in keeping us healthier longer. And also caregiver support. Over 80% of caregiving services in the country are consistently provided by informal caregivers, not by paid caregivers. So where we can strengthen families and enable caregivers to care for their loved ones, that's going to serve us better. Compensation and benefits, of course, is fundamental. And what we've seen over the pandemic is really that rapid escalation in compensation and benefits. We need our public programs to catch up to what our providers are doing. And that's certainly something that we advocate for. That's front and center of our policy when we're in conversations at the State House. And then there are a lot of things that providers can do on their own. So public image and early exposure, what's your reputation in the community? What are your tendrils when it comes to reaching into your local high schools, your local elementary schools even? What are those early exposures that individuals in your community have with older adults? And so that's really critically important. Thinking about career pathways, ladders, and lattices. So do you know what the next 1, 2, or 3 steps are that your employees would like to take in their career? Do they have a plan? Do we need to be coming alongside them to make that plan? Thinking about the environment of work, is your workplace something that brings joy to the staff that are entering there? Is it easy for them to work into their lives? So is it scheduling? How is their relationship with their managers? Oftentimes folks become managers in our field because they've been a great caregiver, but have they ever gotten the opportunity to be given those skills or that training in management? And then certainly looking at the regulatory environment and if there's opportunities to remove barriers. I wouldn't be doing my job if I didn't speak about automation and technology, and also a little bit about immigration policy. If we have a fixed number of caregivers and we know that it's not enough, there's nothing we can do to hire our way out of these challenges. So we need to be thinking about, does a human have to do this task? Be looking at every task within your organization and think, is there a way to automate this? Is it really necessary that a person does this? I've seen things like robots that are replacing, sweeping and floor cleaning so that those individuals can be deployed otherwise. And what that also does is it takes out some of the rote tasks of the job, and it allows the individuals to be spending more time in the parts of the job that it's really critical for a human to be there, like developing relationships with your residents. And then, of course, we can think about system design and care models. So looking at those care models that are workforce efficient. I think about Adult Day as a great example of this. It is a model that really boosts the caregiver role, that informal caregiver role, and is light on workforce, but provides a lot of value and a lot of health promoting in a health promoting environment. So can we prioritize those care models that are efficient in their use of staff? And then I'll just share a little bit about what's going on at the state level. We do have a direct care workforce expansion working group. This group was convened in the summer and has been meeting over the summer. Their goal is to have a playbook that is available for the state to essentially pick up ideas and run with. So some of the ideas that Nicole shared, thinking about a PR campaign for our sector, Some of the ideas that I shared, partnerships with high schools, those are all concepts that are in there. Automating certain activities, those are also concepts that you'll see represented in the playbook that'll eventually come out of this group. You can visit the website here and read testimony and read the feedback that was provided to the working group. It's a really, if you want to go deep on workforce, that's definitely the place to go. It was sort of a everything and the kitchen sink kind of model in terms of the ideas that we're pushing around. And then finally, this is a little bit about what LeadingAge Ohio has been doing. We have Careers That Love You Back. That's an elementary focused program. We are working with local high schools to essentially create a toolkit for providers. We do have apprenticeships. We've been, one of our partnerships actually was with Sinclair Community College, and then really encouraging our members to be thinking hard and sharing best practices about what they're doing with scholarships, paid training, creative benefits, etc.
I'm so happy to be here to discuss this important issue concerning the direct care workforce and how do we address staffing shortages. Thank you. I can see my slides there. And so I'm just gonna get my clicker going. So just as we're jumping into this topic, I think it's really important that we level set with some key data that I've been looking at and that my co-presenters have been looking at that I think indicates what's going on at the national level, but also at the state level. We know that so much of what goes on with direct care workforce issues, a lot of that work is happening, almost all of the work is happening at the state level, and is driven by not just state Medicaid agencies and other state agencies, but also the local partners and providers that are part of the network of services that meet the needs of our community members. And so we know that, according to PHI, one of NCOA's partners, that, there are 20 million adults, an estimated 20 million adults who require assistance with self-care and other daily tasks. This includes 17 million in the community and about 1.5 million in nursing homes and also another approximately 1 million in residential care. Hold on, give me just one moment. I went 2 slides over. And so when we talk about, staffing shortages, I'd really like to look at this in terms of just 3 areas of drivers that are, key issues for these staffing shortages. There's 3 buckets here. We have the challenges that are facing the direct services professionals themselves. We have the challenges that are facing providers, and we have the system level pressures. And so when we talk about pressures and challenges that are facing direct services providers themselves, as Nicole and Susan both, I think, really touched on, we know that the wages are very low. And we know that because of those low wages, more than half of direct services professionals rely on public assistance so that they can meet their own daily needs. It's interesting, just on this note, as Nicole mentioned at the $10 to $12 an hour, I believe, in Ohio for direct services professionals. I actually was a direct services professional in Kentucky over 20 years ago. And I thought to myself, it is amazing that these wages are still the same over 20 years later. And I did have 3 jobs at the time. And so these really are very significant issues. There's also racial disparities. And I think I think Susan hit on this in her presentation. If we're going to be talking about direct care workforce, the services and the professionals that provide those services, we really have to address issues like the wage disparities for women of color, who are more likely to need public assistance, compared to their white counterparts in the direct care workforce. And they're also more likely to be head of household. Institutionalized barriers. We know that family leave and medical policies are huge drivers of these issues and actually help increase the turnover. So when someone has something go on within their own household, a lot of times the agencies don't have and aren't required to, based on their state policies, they don't have, I would say, worker-friendly policies that allow them to take off work. And so you have both lost wages, but then also a lot of times they lose their position. Looking to provider challenges, many of which were exacerbated by the COVID-19 pandemic, but I would say things that have been going on long since before the pandemic. We know that 77% of providers are turning away new referrals. That's up 16.7% since the start of the pandemic. And we also know that they're also having challenges with issues like having to discontinue programs and services, and also struggling to achieve quality standards since the start of the COVID-19 pandemic, and issues that have been going on long before then. And then finally, when we look at system level pressures, we know that the demand for direct services professionals is accelerating and that it's outpacing supply. There's a 33% projected growth in the demand by 2030. And we know that the ratios for caregivers to the number of folks that they'll be able to provide services to is going in the wrong direction as we look out toward 2060. When we look at recruitment and retention challenges, we know that, again, at the system level, 92% of providers are struggling to recruit and retain qualified direct services professionals, and that's since the COVID-19 pandemic, but again, had always been a challenge. And then finally, we know that the turnover is only increasing. So when we talk about the direct care workforce, we know that the majority of direct services professionals are women. And so when we talk about economic security and financial security for older adults, such as what we talk a lot about in my work at NCOA, we know that we're talking about women who have already been working at a deficit for the entirety of their working lives, not necessarily women who are in corporate positions, although they have their own sets of challenges, but women just like the folks we see in who are direct services professionals. And so what do we mean when we talk about women? Well, 87% of direct services professionals are women. And we know that among those women in direct services profession, we know that 53% of them are women of color. And so when we think a little bit to the last slide that I just had, talking about those wage disparities, that's a huge issue. And just a little bit of nuance within that 53% women of color. We know that an increasing number of the women of color are immigrants. And so there's also that issue. And then we, again, just sort of talking about the likelihood, the increased likelihood that women of color are more likely to have to be on public assistance to supplement their low pay, and they are more likely to be head of household, live in poverty, and struggle with issues of housing affordability. We also need to look at direct care workforce issues from the lens of people who need that care. And we know that women are more likely to need long-term care supports because we live longer. We know that 3 in 4 women, based on a study out of NCOA, we know that 3 in 4 women are concerned about the affordability of long-term care, and they want help. 1 in 3 want help aging in place. And 90%, or 9 in 10, are concerned about the increasing healthcare costs. And then finally, among older women, 2 in 3 of those are represent people who have the highest yearly cost burden of chronic disease. So when you look at women who make up the majority of the direct support profession profession. And then you also look at the fact that they are going to live longer, and that they are more likely to need care, but less likely to be able to afford them. You can see how women are doubly compounded by, are doubly affected by these compounding issues. Then finally, in the third bucket, we look at women and their the financial impact that's being and the financial impact on them of providing caregiving for others. So in this case, we're talking about family caregivers. We know that women are 2 times as likely to take time off work or to take part-time work for caregiving needs for their family. We know that 7 in 10 women, among caregivers, 7 in 10 of those women are financially strained by the costs of caregiving. And the lost wages, by the time you calculate it all together with the lost wages and the lost Social Security benefits due to workforce departures related to caregiving, we're talking about nearly $250,000 for individuals. And so taken all together, these 3 factors, I would say that women are hitting a financial wall when we talk about the direct care workforce issues and the very issues that are driving the staffing shortages. And so, there are some really significant challenges, as we've all noted, and as I've just noted here. But we also know that these challenges have created a little bit of success. Everyone is looking at and talking about this issue now, and I think that's only going to increase. And so, with the unprecedented challenges, comes unprecedented action. We are seeing more and more that there are states enacting progressive measures at any given time. About 2/3 of states are enacting progressive measures with regard to the direct care workforce. And we know that recent legislation has enabled and increased state activity to invest in invest in and support our direct support professionals. And so, what does it look like what's going on in the national level? Well, we know that ARPA was passed, and with that in 2021, and with the passage of ARPA, we know that we were able to allocate over $1.9 trillion to address the impact of COVID. Along with that came every state and also the District of Columbia had to submit a detailed spending plan concerning the use of these funds for home and community-based services. We also know that the Supporting Older Americans Act of 2020, which was a reauthorization of the Older Americans Act, included the first time in history a measure that would establish grants to improve recruitment, retention, and career advancement for direct care workers. And then recently, ACL just announced that they were going to have an initiative to strengthen the direct care workforce, and that they would be creating a technical assistance center, a national technical assistance center, to help states with these issues. And then finally, what we've seen is that there's been over 2 times the amount of direct care workforce related action in the last 10 years than there had been in the previous decade. And so when we talk about what's going on and what's trending at the national level, this is really very much a state and local issue. And so I wanted to just take a look at some of those trends that were occurring across states, in addition to what the national enablers were that I just talked about on the previous slide. And so we know that in terms of recruitment, some of the things that are working is hiring and signing bonuses and state-supported marketing campaigns, as well as free training, testing, and certification. And then, you can't just recruit people, right? You need to retain them. And so we know that retention bonuses and performance bonuses, as well as providing folks with things like career ladders, is really important. And then we can talk a little bit about training, right? We know that training linked to job placement and promotion, mentor programs, including peer mentor programs, are also really important. Culturally competent training, meaning culturally competent for the direct services professional. And then finally, There are trends going on in reimbursement that states are looking at, pay for performance, uh, making sure that most of the money that's paid is passed through to staff to focus on issues like recruitment, retention, compensation, and training. And then finally, I'd like to just take, I know I'm going to be just a minute over, I'm going to talk a little bit about what NCOA, what we're doing on this topic. It is our goal and mission to improve the health and financial security of 40 million adults by 2030, and that includes BIPOC and LGBTQ+, low-income and rural individuals, and especially women across all of those demographic groups. We have an all-in issue in which the entire organization is focused on women. And as I mentioned, women are direct support professionals, we are family caregivers, and we are also care recipients. And so we are triply affected by these issues. And so, there will be more to come. We'll be making some public announcements and press releases soon. But I would encourage everyone to just look out for work we'll be doing concerning serving as an information hub and resource hub for stakeholders, especially women who are direct support professionals, as well as their providers and state entities who work with employers. Also, capacity building efforts. We're looking to provide technical assistance as well as subject matter expertise to support systems, providers, and consumers, as well as family members. And then finally, we will be doing stakeholder convenings, conducting work sessions to help shape our work, as well as the work that's going on at the state and local levels.
Thanks, Aisha. Boy, so much information that we just got from our three speakers. We are going to jump right into questions. My first question that I have is for Aisha. There's this whole concept of this gray market for home care workers, meaning independent contractors who are hired by word of mouth or through online marketplaces like Craigslist. Many of these workers are working off the book. Some pay no taxes, so they're not getting Social Security. They don't have insurance. Is there any movement to try to either legitimize the important work that they're doing or to regulate the independent contractors?
Absolutely. There's a lot going on concerning the gray market for direct care workers. I would say, just sort of, I feel like I'm hearing an echo. Am I echoing, or is it okay?
You sound good.
Okay. And so, yes, we know that there's work going on. And I would say one of the biggest issues is that, with the gray market, it doesn't allow us to truly capture all of the workforce data. So the data that we talked about here, we're leaving out a huge chunk of the population. And so there's definitely work going on with PHI and with NCOA as we're looking to encourage some national work on and strategy on this issue the National Domestic Workers Alliance. All three of these entities are working on this issue and working with policy providers on this matter.
Very good. We have a question for Susan. Low pay, low status, and physically and emotionally demanding work have plagued the long-term care industry's hiring ability for years. So you mentioned how a lot of these facilities are already strapped. How are they finding new sources of hires? I know you said that hiring isn't the only way to go, but are they finding innovative ways to find new workers?
So I think there are some ways that we are seeing maybe more creativity. I think that in recent years, I've seen more providers that are taking responsibility for creating their own workforce. So being much more proactive in their outreach to schools, in their partnership with technical schools in the area. So certainly that's one piece of it. I think the other piece is just taking a really hard look at our sector and thinking about the quality of jobs that we're offering and making sure that we are creating jobs that invite folks in. So I think that's important to think about, the mental health of workers, the support that they receive, and particularly looking at that experience in that first 90 days to 1 year. That's when we see the highest level of turnover. So once we get them in the door, what is their experience? So really looking at our hires the way we've traditionally looked only at customers, and not just presuming that we're going to, post something on Indeed and we're going to have folks walk in the door. That's really not the way we're seeing it. I think the other opportunity is for folks to be really thinking about their staff as ambassadors. So we find across our membership, they typically find that those that have, those staff that are new hires that are more likely to stay are those that maybe came in from a personal referral. They have a much more accurate picture about what that work is going to be. They also have some built-in social support that's going to be able to walk them through if it's a friend or a family member that's with the organization. So I think that's another underutilized area for organizations. So it's not that we have new pools of hires. That's not the case, but we need to get really smarter and sharper with the pool, the pools that we currently have, and really exhausting every avenue.
I love that point that it's physically and emotionally demanding work, but it's also hugely rewarding work compared to some other jobs. And so once you get in and you have these relationships with the people that you're working with, it is one of the most rewarding jobs that you can find out there. I mean, you really go home at the end of the day tired and drained possibly, but also feeling like, boy, I really made a difference in somebody's life today.
Mm-hmm.
Nicole, what senior industries in the counties that you serve are you seeing the most significant employee losses? You had talked about home health aides. Are there other industries as well?
Oh, absolutely. Of course, our assessment was just focused on the personal care aide, home health workforce, but we are seeing it across all of our services and service providers. Transportation providers have been directly impacted by the loss of drivers in the workforce. That translates over to home delivered meal providers are also finding a difficult time finding drivers to get their meals out and delivered. Um, I forget whose presentation had mentioned, I think it was Susan with adult day service. That is a model that we're really trying to get revamped and going again. All of the adult day service centers had to shut down because of COVID and are really still struggling to be able to get back open, not only because of staffing shortages, but other variables as well.
Very good. We did get a question about whether copies of the slides will be available. We will share this entire recorded video, and we can get copies of the slides to everybody who's in attendance. So we will send that out by email after the event. Aisha, is there any current legislative activity to increase the reimbursement rates by Medicare and Medicaid? It seems like from what I've heard from all three of you, that's one of the biggest issues. If you can't pay, you can't have a bake sale to raise money to pay for ongoing salaries. So what do you see at the federal level? And I guess also related to that, what level of confidence do you have we'll be able to push that through to really get that living wage that people need? Because as you had said, one of the things that really hit me was we're paying for this either way. We're paying a lower wage, but then we have people who are getting government subsidy, where if we just put that into the wage, they might not need the government subsidy and would have a living wage. Share your thoughts with us.
Sure. There's definitely work going on to address increasing the amount that people are paid, and certainly increasing the reimbursement. I think one of the key things that is happening federally that has driven, I would say, some of the state activity in this area. I mentioned it in my presentation, was ARPA, and we know that all 50 states have things that are going on regarding how we pay and support our direct support professionals. And so we're seeing things like making sure that those funds actually pass through to focus on wages, to focus on training, to be able to provide recruitment and retention bonuses. These are the kinds of things that we're seeing to make sure that folks feel supported, and to make sure that they have, I would say, pathways for advancements in their career. Those are the types of trends that we're seeing that I think this is a great example of where federal legislation is really driving opportunities for states to be able to do things. In terms of issues like living wage, um, I would say we are still a bit challenged. As you know, wages are set at the state level. And so it's really just going to be state by state. But what I will say is, and I mentioned this also, at any given time, you have about 2/3 of states working on issues related to the direct care workforce. That was before before ARPA was occurred in 2021. And so a lot of the things that folks are working on at the state level is being able to figure out how do you thread that needle to make Medicaid and other funding sources work to be able to increase wages and work on some of the innovative things that I just talked about with regard to recruitment and retention. We're also seeing things like state funded pools of money to be able to provide things like training, again, that would focus on direct support professionals. Still a long way
Very
to go,
good.
though.
Yeah, it's tough. I read a statistic that by 2030, half of the federal budget will already be going to older people in the terms of Social Security and Medicaid. So it's not like there's more money out there, but using it in smarter ways, like you're talking about, seems to be the real key. Susan, you talked about skilled nursing facilities and shortages of workers. As you look at the facilities, in some cases, we've seen skilled nursing facilities close, but in many cases, one of the things that the public doesn't see is just a reduction in beds. So our total capacity in a community, the nursing home down the street from you might still be open, but they don't have the same capacity to bring people in. How do you see that impacting people when they get to the point, and I guess the consumers thought that there will always be a skilled nursing bed for me if I need it?
Right. So that's a great question. And I will say that, just because of the history of the Medicaid program, skilled nursing was sort of one of those foundational and central features. It's one of the required state plan benefits. And so even when you look at our waivers and things like that, it's built on sort of a waiver from the presumed availability of nursing facility beds. And what we've seen in the pandemic is a couple of things. First, there were just, folks that made other choices because it was perhaps safer and better to do so. If you had a caregiver that was working from home now, perhaps rather than having that inpatient procedure and follow up in a nursing facility for rehab, you're going to have that procedure done outpatient and then following up with a skilled home health stay instead. And so we saw sort of a natural shifting of what the market demanded that went on during the pandemic. And frankly, some of that has continued. Folks have figured out, I think we've had a reassessment of values and folks have figured out how to make things work that perhaps didn't seem to be an option before. But the other piece, as you mentioned, is just the ability to staff. So most of our members, we represent roughly 120 nursing facilities across the state of Ohio that are included in our membership. And most of them would say they have at least a portion of their facility that is closed. And so we saw census drop from, it was already in the 80s, which is considered low. It dropped into the 60% occupancy during the pandemic, and it has rebounded somewhat, but statewide it's still around 75% occupancy. So that's very, very low. If you're thinking about a quarter of what you would presume would be your normal operating business is just gone. So what you said, we have seen some providers relinquish beds. I think some providers are still sort of holding on to those beds and hoping that they're going to see even more rebound in census. But I think we're eventually going to see some closures. We've seen some so far, but I think some folks are kind of holding on, and we've had sort of each round of relief that comes out helps to kind of keep us holding on a little bit longer. And in fact, we're working on one of those, another round of relief for Ohio providers as well. So I think there's sort of multiple things going on. I do think we're going to be seeing a right sizing of our nursing facility space in Ohio over the next year or so. And I wouldn't be doing my job if I just didn't plug. We are heading into election season and a lame duck. And right on the heels of that, we're going to be doing our budgeting. And so that's when, to Aisha's point, that's when we make our decisions about what we pay nursing facilities and what we pay passport providers and what we pay direct service providers and others. So if there's an issue that's really important to you, it is so worthwhile to take a moment, put your thoughts in writing, and get that out to your legislator. Let them know exactly what's going on in your community, because you can have a real impact. So.
Very good. Nicole, you had talked a little bit about the whole wage disparity in hiring. Are you seeing any kind of innovative compensation packages that are helping people to bring things in? Maybe not, maybe it's direct pay, but maybe non-direct pay benefits that are really giving some employers an edge in hiring new people?
That's been a real challenge, and I don't know that any of our local providers have been able to do much innovation. But one thing that we as an agency have tried to do is help support onboarding employees who may not be eligible for hire yet. It's important to remember that I feel like the home care industry is a bit unique in that you have to come trained and certified to even be eligible for your job. And most employers, of course, will pay to provide you orientation and to provide you training. But our region's home care agencies really just don't have the ability to do so, which really limits their recruiting efforts. So we have worked closely with some of our regional providers to be able to help support them with collaborating and paying for training for hires that are coming to them. And also helping provide some stipends for things that, you may not think of are needed during that onboarding process, such as a background check or a TB test, scrubs, perhaps, helping support with transportation to and from the training site uh, to be able to help that candidate become accessible and then successfully hired.
There was talk about the big age gap where you have younger home health workers and then you have a lot of home health workers who are also older, who are, 50, 60, 70 plus years. Is that an opportunity? Is there an opportunity to look at people who are retired either as volunteers? I know in our area there's a lot of churches getting involved. What do you see as that as a possibility? It's certainly physical work, but you also have then somebody serving who understands what the issues are at hand. I'll just throw that out to all three of you. Are there opportunities kind of on the volunteer side or using older workers?
I can start and then kick it to Nicole and Aisha. So I guess two things that I thought about. One is that we do have a member who is piloting a volunteer workforce. So what would it look like to, develop a core of volunteers? And I'm somebody that used to be a hospice social worker, and in hospice, you actually have to deliver 5% of your services via a volunteer. And I wonder how many folks, particularly home care, maybe need a little bit of light service, but don't need all of the service that you get with a personal care aide. So I do think that's an opportunity. I think there are places we can look for learning on how to deploy that. The other thing is I think there's a real opportunity in injury prevention for a workforce, and this is particularly important for extending the careers of individuals, for those workers that are later in life, and certainly those that are working within facilities. We have one member that actually got secured grant funding to put in lifts, and they were able to extend the reduce their injury rates with their and by doing so reduce their Bureau of Workers' Compensation, their insurance costs, but also extend the time that their workers, they had workers that were about a foot out the door, they couldn't deal with the pain anymore, and now those workers can move folks with the touch of a finger. And so I think that's what I think about using technology in creative ways. There's ways we can rethink. That's harder to do in a home care environment, but are there environmental modifications that we can prioritize so that we are kind of stretching existing careers? So
I would say nationally, we're definitely seeing, first of all, an increased demand for older workers to be able to work as direct support professionals. And Susan, I really loved what you said about leveraging technology, because as you are talking about in older workforce or people who are extending careers or trying to figure out a second career, because they are no longer able to afford living off their savings, or the benefits and so forth are not enough for them. This is just a tremendous opportunity, either as a volunteer or as a paid worker. which I think we can't forget the opportunity to hire older adults to be a part of the solution. And so I do love what you talked about in terms of using technology to free up people to do the thing that really is important to have, that human element, and that is working with the care or service recipient to have that human interaction, as well as working with the family to be able to coordinate what family caregivers might need to be able to provide supports to their loved ones. I think the last thing I might say here is that, you know, I think we might start to see, as we're looking at data trends, and I think I want to, you know, as Susan says, I wouldn't be doing my job if I didn't underscore the importance of trying to get a national data set together. But I think as we start to work on those types of issues, like getting a national data set together, not only will it address things like you talked about sort of this gray market, you know, but also it will help us address understanding what contributions older workers are already making in this area. You know, when you talk about direct support professionals, you know, it might be someone doing physical work, but it could be a services coordinator. It could be someone who's preparing meals. Those are all things that I think open us up to being able to employ either as volunteers or as paid workers, older adults. But I do think that a national data set to really understand the full scope of what these roles are and what the possibilities are and who our workers are will help us to better understand the nuances around older workers in these roles and other issues like the gray market piece that you asked me about earlier.
Mhm.
Yes, I completely agree. I think there is a tremendous opportunity with older workers and volunteers. And one thing that we hear so often from both personal care aides, we hear so often from personal care aides that, you know, training and mentorship are things that are, you know, very valuable to them. And oftentimes, you know, their agencies just don't have the staffing to be able to provide that. Being in home care is, I think, extraordinarily challenging because you're put out into someone's home all alone and you don't have your coworkers, you know, right next to you to be able to troubleshoot if a situation has come up. And so I believe that could present an opportunity, you know, for our workforce using older workers or volunteers to provide that mentorship. And then conversely, we also hear consumers and the older adults themselves, you know, seeking out additional education for the aids that they have. And perhaps, you know, a peer older worker or a volunteer could help provide those additional hands-on skill set training.
Excellent. This question just came in from one of the attendees. What types of improvements are you seeing just in the physical improvements of homes that will allow people to take care of themselves a little bit better, whether it's changes to the house itself where people can get around, or, you know, elevators, stair lifts, or even technology like in St. Mary's buildings, we've put in free Wi-Fi and Amazon Echo devices to be able to help our residents connect with healthcare providers and family and others. What types of things are you seeing in the single family home market that just allow people to live there a little bit longer?
Sure. I can answer that quickly. I think that that is something that we have learned quickly in providing services is because we cannot get the personal care aides out into the homes of the seniors that we're serving, we really have had to be creative in how we can provide different supports to be able to keep those individuals at home, such as things like minor home modification or increased chore services. And, you know, I think, Tim, you mentioned every example, you know, and certainly there are probably others that are out there that, you know, I just encourage anyone to bring forward so that we can really evaluate it internally to see if it is something that we could put in place in that home. But I absolutely agree. We've seen a tremendous increase in minor home modifications, as well as additional chore services in the absence of personal care.
And
I would
I would
just
just add that I
add
think
that.
there's, go ahead, Aisha.
Go ahead.
Well, so I was going to add that I think there's an opportunity to also think beyond the traditional home modification and think about what are those home enhancing technologies. So certainly I have one member who said multiple times grab bars, and this is a very dark comment, but has said grab bars and Life Alert are the caregivers of tomorrow. But I would say things like Alexa, so a voice activated, things that you don't have to remember to put on your body. So voice activated home devices that can connect you with loved ones that don't require necessarily any technological understanding or skill. They can be essentially set up, can provide socialization. We have members that are looking at, can we use voice activated health screening so that we can prioritize how we're deploying workforce into the field each day, rather than having, okay, you're going to have the same 2-hour visit every Monday, Wednesday, and Friday. Maybe we're going to check in with you and see how you're doing each day, so that we can make sure if you don't need it that day, we can redeploy that aid somewhere else, so we can be smarter. So those are things that we're talking about, but I think the voice activation is really key when we're thinking about. I think we've thought about our built environment with universal design for a long time, but we don't always think about our technological environment. So, and I would say that on the DD side, there is a technology first approach in the state of Ohio, where they would prioritize a technological solution over necessarily a human one, because it enables that person to maintain independence. So that's something that we've looked at with our waiver services. Is there a possibility to create a reimbursement service that allows the purchase of the device, a certain ongoing cost, and then the training and assistance for setting it up?
So I was just going to echo, I think, Susan, a bit of what you said, and sort of using things like telehealth to be able to figure out, to your point, do we need to deploy someone that day, or can we just check in and see is everything okay? And if it is, then we can deploy someone to someone else's home. I think also things like telehealth allow us to check in with people who are in less accessible settings or rural settings, for example. And then I just also wanted to say that at the national, I guess we might call it the national level, but I wanted to just plug here that Medicare Advantage or Medicare Part C, the supplemental benefits, can be used for these types of things that we're talking about. And so it's really important for, at NCOA, we encourage our benefits enrollment centers, as well as any of our community-based organizations that are connecting people to benefits that they are entitled to, depending on what their Medicare plan is or what their health insurance or health coverage plan might be. These are things that are going to cover things like Sterilifts, making sure that you can make minor modifications to your home, and then also things just like food delivery and other things that we think about that direct support professionals are providing support for, and home and community-based services providers are providing supports for, but that you can be looking at how to get reimbursed for those things.
Great ideas. And if anybody who's watching would like to get St. Mary's recent white paper report that we did on implementing Amazon Alexa devices in our buildings, what we learned about one-on-one training, what residents needed, you can just go to the research tab on our website and download that report. So one final question for all three of you. If you could just give one recommendation for how employers could better hire right now, and one suggestion for how they could better retain their good employees in this challenging job market, what would it be? So one recommendation on hiring and one on retention.
I'm happy to start. I think what we've seen as far as a recommendation in hiring, again, is to explore resources in that onboarding process, and try to be innovative in how, when someone comes to you, how you can help support them financially to be able to get through that certification process. And as far as retention is concerned, I think something that really could be valuable is among our provider network to really collaborate together, and really almost kind of form your own home care alliance, so that you can can rely on partner agencies. So many of the agencies that we work for are small businesses. And I do believe there's some value in those businesses being able to come together and look at different strategies they can work together on with retention.
So I guess I would say I can't narrow it down between two for hiring. So I'm going to include both of them. So the one is really, if you're not already partnered with your local high school or technical school, you need to be partnered. Understanding just a little bit about Ohio's alternative graduation pathway will help you to prepare students, and you can be a solution for your schools as much as they're going to be a solution for you. My first job was as a resident assistant in a assisted living community in the Dayton area. And here I am 30 plus years later, and still in the field. And so I think it's just really important when you think about our developmental reality. So we typically form a lot of our identity in our young childhood and in our early adulthood. Those are two peak areas where we're really forming identity. And so it's important for us, if we want to create workers for a lifetime, to be interfacing with those two groups. So that's one. The other one would be advocate for immigration reform. As I mentioned, we have sort of a closed unit if we're not looking at other ways to change our demographics. And so immigration is a great opportunity. One of the pressures we also felt during the pandemic that we haven't gotten to talk about is the fact that we froze immigration for 2 years. And so all of those folks that are likely nurses, nurse aides, folks that are on the grounds crew, those are all folks that are oftentimes individuals from other countries. So that's something that I think, that is really worth a lot of advocacy in this space. And then on retention, I would just say a first step would be doing an audit of that onboarding process. What does that first 90 days look like for a person? Do they have a best friend? Do they know where to go? What do we know about our new workers, right? Do we know, what their love language is, how they like to be encouraged or recognized? That's really important. And I think I would just encourage folks to audit your processes and don't be afraid to get personal because that's what we expect of our workers. So we should be reciprocating that to them.
And so mine, I think I've whittled it down to one. I had two that I kind of tried to finesse into one for the recruitment. And so I would say, with regard to recruitment and placing people, I would definitely be looking at schools and working with them to directly place professionals upon graduation, and even with mentorship programs starting while they're still in school, being able to place them directly at an employer. And couple that with, this is my part 1B, I guess, couple that with strategies to ease the transition financially, because we know it is just such a financial strain. And so I talked about signing bonuses, but you could also do things like benefits, which I think, Nicole, you talked really wonderfully about. It's those little everyday expenses, such as transportation to work and other issues that create barriers where we should be creating pathways and making it easier for our direct support professionals. And then finally, with retention, I would just say, as we look at women of color and immigrants who really make up the majority of the direct care workforce, it's really important to make sure that they have a voice in terms of what matters to them. Of course, I know that, money always talks, so those types of retention bonuses and performance bonuses are really great, but letting them have a voice is the most important thing, so that we can make sure that the environment we're providing is culturally sensitive, that the training that we're providing is culturally competent in terms of the person on the receiving end of the training, and that they can really, I would say, have a pathway for advancement, so that they can continue to shape those retention strategies in that workforce environment for themselves and for their peers who are going to look like them increasingly as we go through each year. So that's what I'd say.
Great suggestions. Well, we've reached the end of our time. Thank you to our speakers for sharing all of their expertise and suggestions. And thank you to our sponsors again for making this event free for everybody attending. And thank you most of all for you who are attending today. Feel free to share this video with others after we send it out to you. As I said before, every year St. Mary Development does the business of aging to address the critical issues that are facing us as organizations and most importantly, the people that we serve. And so we hope you'll join us again next year on Thursday, October 5th, 2023, as we continue to work toward building a better quality of life for older adults. Thank you and have a good morning.